So I'm going to kick it off with our first keynote speaker for the afternoon, who is Ruth Limkin. And she is going to be discussing the question, and this is one that I've been looking forward to, the question of why are we burning out? Now, I imagine a lot of you would have some theories on why we're burning out. But Ruth is the founder of Banyans Healthcare. It is a world-renowned luxury clinic serving professionals and public figures. Ruth, I'm very interested. I'm very curious. Ruth looks at treating burnout, mental health and addiction, and is passionate about helping high-performing individuals stay or get back on top of their game. So please welcome Ruth Limkin to the stage.
Well, I hope you enjoyed lunch today. I feel like the answer to why we're burning out is everything we heard this morning, and that's the end of my talk. I am Ruth Limkin, founder of the Banyans Healthcare. Why are we burning out, but most importantly, what can we do about it? I'm not going to leave you hanging. I am the founder of the Banyans Healthcare and also now the Sana Health Group. We're building out a network of treatment centres because we think there needs to be more help for mental health, addiction and burnout rather than less help. So we're wanting to increase the opportunities for people to get help. We have two residential treatment centres now as part of the Banyans. Yes, it's as beautiful as it looks, it's even better. We're based in Queensland. We have clients fly in from all around Australia and from all over the world because our clinical model is quite unique. It's all one-on-one therapy and it's that biopsychosocial model. It's multidisciplinary teams and we provide help for burnout, mental health and addiction, including eating disorders. We also, a few years ago, opened quite an innovative day clinic that was particularly opened after I heard women talking about the fact that they couldn't get to the residential services, but they still needed help. So we were trying to find ways to decrease barriers and increase opportunities to access care for burnout, mental health, eating disorder, and addiction. We do track our clinical outcomes. We know that it's working, even though this model is quite unique. For the clinicians in the room, this is Novopsych data. 88.9% effectiveness for clients who attend the Banyans Day program and 76.1% impact during that treatment program. I'm very passionate about helping people get back to the top of their game so they can flourish in life because Australia really needs it. This is a report from last year. In a study looking at high-income countries, Australia has the highest proportion of adults reporting a mental health need. We have an epidemic in our country. We are starting to talk about it in the last few years, but we need to continue to talk about it. The Banyans has seen a 684% rise in inquiries for stress and burnout. It's a very confronting situation. And I am particularly passionate about putting women at the front and centre of this conversation. Why am I passionate about putting women at the front and centre? Because the never-ending battle that women face to do it all and be it all takes its toll. In Australia, we know that women are dealing with mental health issues at a disproportionately higher rate than their male counterparts. More than a third of women aged 16 to 85 in Australia will experience an anxiety condition in their lifetime compared to 1 in 4 men. Research that the Banyans has done in Australia reveals that 3/4 of women report worrying about the expectation of others compared to 62% of men. We know untreated stress and burnout can profoundly affect the quality of our life. It impacts our relationships, it impacts our physical and mental health, it impacts the overall quality of our life. In our work lives, it leads to decreased productivity, diminished creativity, and a higher likelihood of making errors. And we find ourselves in a relentless race against a rapidly changing, complex, difficult world. I believe this sense of change and the pressure to succeed and the pressure to be it all and the pressure to do it all and these overwhelming expectations that sometimes we place on ourselves, but certainly we find from the world in which we live, creates a crucible that will either defeat us or refine us. So all is not lost. But to the big question, why are we burning out? 3 things I want to share with you today. The first is that I believe we are immersed in a worldview that works against us. So diminishing well-being and the increase of burnout starts in thought patterns, I would believe, and these thought patterns come from being immersed in outdated social mindsets that busy is better and that results come from just working harder. We live in a culture that glorifies the veneer of getting it done without interrogating the viability of what actually sits behind that and the expectations that we're putting on others. I don't know about you, but I know a lot of organisations and people where long days, full diaries, the absence of holidays, the hustle are often seen as virtuous rather than a vice. But the question I want to ask today is, what if that thing we've been wearing as a Medal of Honour in our society is actually a weight around our neck, dragging us down and burning us out? You see, all the science points to the fact that the opposite of this is true. All the evidence points to the best results come from someone who takes care of their well-being, including active rest. So, for example, a study by San Francisco State University found that professionals who engaged in creative hobbies outside of work, rather than just being work, were better at problem solving at work and more helpful to their colleagues. Activities like painting, writing, or playing a musical instrument provided this form of active rest, allowing those individuals to approach work challenges with a refreshed and innovative mindset. So rather than feeling guilty because we're doing something other than work, we can start to feel empowered that actually this active rest can actually contribute to our whole of life productivity. But in a society that seduces us to follow on the race of life rather than the rhythm of life, it actually takes a lot of courage to resist that narrative. It takes a lot of intentionality to step away from that mindset that busy is better and that's how we're responsible, to embrace the science of human performance and well-being, which includes active rest. I've learnt a lot over the last 9 years about recalibrating those rhythms of life and work. And when we learn to view life and work not as competitors, but as collaborators, there's a rhythm that we can start to find for ourselves that helps us swim against that rising tide of stress and burnout. I also want to mention that for busy people, who I suspect a lot of people in this room would describe themselves as, making time to attend to well-being can actually save time later. Again, in my own life, nearly 5 years ago, I was tempted to ignore a lump I felt in my breast one night. Didn't want to bother going to the doctor because I was very busy. Like every good person working in healthcare, I was like, I'll just ignore it. But the next night, when it was still there, I literally heard myself giving a talk that I do for the Banyans in different workplaces about well-being and thought, well, Ruth, you better practice what you preach. Don't be a hypocrite. Go to the doctor, it will be nothing. Well, unfortunately, it wasn't nothing. It was something. It was breast cancer. But because I caught it early, the impact of treatment was so much less than if I had ignored it for another 6, 12 months. Yes. So when we pay attention to the body's signals rather than ignoring them, and when we actually realise that true responsibility and caring for others means first caring for ourselves. When we listen to our body's signals, that's what sets us up for a more sustainable life. But if we unthinkingly buy into a worldview that busy is better, we set the scene for burnout. The second thing is that our ways of winding down deceive us. Now, I'm excited to hear the talk about quality sleep, which is going to be on a bit later, because I know quality sleep is crucial for preventing burnout. In very simple terms, when we don't get enough sleep, our metabolism of glucose, which gives us energy, goes down, and the stress hormone, cortisol, goes up. When we consistently get too little or poor quality sleep, it sets us up for burnout. And yet we've developed ways, largely as a culture, of winding down that actually hijack our sleep rather than help it. So one, I don't know if you've heard the term revenge bedtime procrastination. And it affects women. It's when busy women who feel like they don't have any time for themselves during the day want to get some time at the end of the day and put off going to bed, even though they're tired. And there's a lot of nodding going on for maybe the person sitting next to you. And so instead of going to bed, even though you're tired, you scroll or you watch that extra episode on Netflix. You know, really interesting, that habit of scrolling means our brains keep getting these little hits of dopamine every time we discover something new, which again sabotages our ability to rest and start to get good sleep. The other way of winding down that deceives us is wine o'clock and using alcohol as a way to relax. You know, many of us develop a habit of, you know, maybe when we get home or after dinner or after the kids get put to bed, pouring ourselves a glass or 2 or 3 of wine to help us get to sleep and unwind. Now, again, it's a little bit seductive because it does make us feel tighter in the moment. But alcohol is both a depressant and it also disrupts the quality of our sleep, particularly that crucial REM sleep. Again, it diminishes our sleep quality and contributes to fatigue and burnout. But winding down well is actually an essential part of maintaining our health and preventing burnout. The third reason that we're burning out is we go it alone when we should ask for help. There is a myth that asking for help or prioritising self-care, or as I like to call it, self-management, because that feels less fluffy, is a sign of weakness. But that couldn't be further from the truth. And I've been so encouraged by the women who have been sharing their stories and encouraging us to reach out for support. We need to reframe support seeking as a strength, not a weakness. Don't try and get healthy or stay healthy in isolation, because that reduces our well-being, while people with greater social connectedness report reduced depression. So what do we do about all of this? Well, we have a model at the Banyans. You will be able to download a workbook that's got this in it, so you don't have to quickly take a photo. That's got 6 facets of well-being, but importantly, see the way the colours all bleed into each other? That shows that actually good news, you don't have to add 6 things on your to-do list to improve your well-being. One change can have positive ripples through this dimension of well-being, and I'll give you a QR code in a moment. So what do we do? How do we change this? The first one is simply, just one small change can produce outsized outcomes. So can I please encourage you, do not walk away from today trying to change everything in your life. Just make one change in the next 6 months. Just keep it really simple. Otherwise, we feel overwhelmed and we can't do it. So for example, you'll see in the resource you can download soon, walking in nature compared to walking in urban environments reduces your cortisol levels, that stress hormone, by 12%. So you might decide, well, I'm just going to try and get into nature once a week or once a month. That's free. That's an ability to do it. The second thing to change this is just try and do it sustainably. Do not try to add more activity to your life because no one's got time for that. Just swap something or stop something. It's that simple. It might be swapping that nighttime wine for a sugar-free, low alcohol or alcohol-free drink. There's so many great ones coming out now. Or you might swap that nighttime scrolling for, I don't know, even a paper book, like fiction or a biography or something that you love and that will promote sleep quality. Thirdly, do it supported. Don't try and do it in isolation. We are much more likely to stay on track if we have someone on this journey with us. Grab a friend, tell them you want to resist that burnout epidemic, and tell them just that one change that you want to make in the next 6 months, and catch up regularly to stay on track. So putting all of these 3 things together, it could be as simple as, for absolute simplicity, sustainability and supportedness, swap going out and sitting down for drinks with catching up and going for a walk in nature with a friend once a month. Maybe that's the one thing you do to start to change the rhythm of your life and resist this burnout. And so I want to ask you, what's just that one thing? And I'm really serious, ladies, when I say just one thing. And that's going to be hard work walking away from today, because there's going to be all these things. For the next 6 months, just focus on one thing. Keep it really simple. So as the Banyans, we wanted to do something really tangible to be able to support, because I love, as soon as Tyler told me about this, I'm like, yes, we're in, we'll do something. So the first thing is that we've got a Wellbeing workbook that you can download and take away to use for yourself or your teams. If you're in an organisation or a leader, feel free to use it. Feel free to photocopy it, do whatever you need to do that. I'll give you a QR code shortly, you can do that. The second thing is, as part of our support for this summit, we have made available for one attendee today, I don't know who it is, it's here, how exciting. We've made a resilience reset program available for someone who can walk away with this at our beautiful clinic in Bowen Hills, and it can be delivered in person or by telehealth or a combination. So I'll tell you who this is in a moment. I feel like there needs to be a drum roll. But here is the QR code if you want to download the workbook. And in a moment, I'll also put up my contact details. And if anyone needs more intensive support for themselves, for their children about anything, or you're just not even really sure how to navigate what the next step in getting support is, I'm always happy to hear from someone on Instagram or LinkedIn, or send me an email or call me. 2 nights ago, I was Instagram messaging with an amazing mum whose 18-year-old daughter had nearly overdosed on the weekend, and she said, I don't even know where to start finding help for her. So I was like, okay, we kept talking, and then I spoke to her yesterday. I talk to people all the time who just need someone to help them navigate those first few steps to getting help and support. And I'm always passionate to do that because I'm passionate about reducing barriers to accessing care. So my details are 3 great books. The Rest one changed my life because it shows you that you can actually get more done by working less and resting better. They're my contact details if anyone wants to contact me and just need some support or ask some questions or anything like that. So, I've got the winner. How exciting is this? Yes, a drum roll. Everyone do a drum roll. Shilpi Sharma. Oh, yay! Congratulations. Well, actually, I'll give that to you. I'll email you, we'll talk, and we'll make that happen. The team will make that happen. Oh, yay! So let me leave you with this question. What one thing will you commit to, starting today, to navigate that crucible and let it refine you to emerge stronger and healthier? And I'm cheering you all on. Thank you.